Hello and welcome to Askimo TV. I'm talking today to Daniel Waller. Daniel is a primary care and hospital optometrist based in London. Hi Daniel, how are you?
I'm fine, thank you. And how are you?
Very well, thank you. Daniel, today's discussion is going to be about myopia or nearsightedness. So let's begin with what is myopia and why does myopia occur?
Myopia is, as you've nicely described, nearsightedness. Why does it occur? There are a couple of reasons. One has to be genetic. Mum and dad are short-sighted as well. More interestingly, I think, is there's also environmental factors. What you get up to, what do you do? Nice work, for instance, was done on Eskimos in the mid-1970s. The grandparents, who were essentially hunter-gatherers, totally illiterate, had less incidence of short-sightedness than their grandchildren, who were a totally literate population, and that's only within 2 generations. There's a significant increase there. Whoops-a-daisy. There we go, I lost you, sorry.
How common is nearsightedness and who does it affect?
Short-sightedness is very, very, very common. Who does it affect? It can affect anyone and everyone. Again, going back to the genetic factors and what one is doing. So just because one parent aren't short-sighted, if you're doing a lot of close work, then maybe you will become more nearsighted.
How is nearsightedness diagnosed?
How is it diagnosed? Interesting question. Generally, what tends to happen is most patients will be coming to us and saying, I can't see in the distance. A child might be saying, or they won't quite say this, I can't sit at the back of the classroom, talk to my friends, and yet still see what's going on at the front of the class. May just be someone who's just starting to learn to drive, never really had too much of a problem in school or college, but when they come to driving and checking things on the number plate, whoops, I can't see that. How I would be doing everything, I would shine my light into a retinoscope into one's eyes and I work out the prescription.
How is nearsightedness treated, and would your treatment be different for adults and children or the same?
First of all, I think we have to say that spectacles are a bit like shoes. And in the way that all spectacles or eye correction allows us to do is to interact with the rest of the world for particular tasks. So if someone's doing a lot of reading, they may not feel that need for correction for the distance work. On the other hand, if they want to be able, as I've already mentioned, to see to drive, or not get into trouble with teacher but still chat to their friends in the classroom, then they're going to need either, or certainly, some form of spectacles, but there are other things that we can do at this stage as well.
How will nearsightedness affect the person's lifestyle, and what will happen if it's left untreated?
Very, very interesting. Children who are left uncorrected until slightly later on tend to be either rather introvert. If you think about it, if one was to take their glasses off, how big is their world? They can't see further than their correction. So if they're just something like -3, in other words, they can't see further clearly than 1/3 of a meter away from themselves. it may cause them to have headaches, because if one makes one's eyes look a bit like, or squint a little bit, as one would say, you can see a little bit better. That may cause someone headache, may make them very bad-tempered. So in many different ways, I think.
Thank you, Daniel. Thank you so much for talking to me today.